In today's hearing, we will be giving an overview around HIV and AIDS in California, as well as information on preventative medications that can reduce the individual's risk of contracting HIV. We will also hear recommendations for increasing awareness and uptake on those medications that are now made available to us. In 2014, there were approximately 122,000 people in California living with HIV and AIDS. This disease has particularly affected minority communities with high rates in the African American community and large numbers of new infectious cases among the Latino community. The work of advocates and healthcare workers, patients, and policymakers cannot be counted out of this discussion. It's very important that we bring everyone to the table to have this in-depth conversation. The National HIV and AIDS Strategy was released in 2010 and provides the nation with directions and directives on HIV services. Other states such as New York, Massachusetts have developed a statewide plan, but California has not done so. And it is certainly our desire to bring people together to have a robust conversation and create our own strategy so California can be counted among those progressive states that will address this growing epidemic. The State Office of AIDS is currently planning meetings to discuss laying the foundation for getting to zero new infectious cases in California. Our first hearing was held in San Francisco last year. At the hearing, we heard from a wide variety of local elected officials and state departments and community-based organizations on how the state can develop a plan. We also learned how the state can best address the needs of disadvantaged communities in implementing such a plan. The second hearing took place in Los Angeles, was held and also in March. At this particular hearing, we began to discuss the varieties of barriers encountered by individuals in their quest to get access to much needed services. The panel discussion was very robust and very interactive and got heated at times around the barriers in which individuals have experienced in their prospective communities, and gave recommendations on how to address those barriers moving forward. Today's hearing will focus on another tool that can be used to fight HIV and AIDS epidemics by preventative medication that can reduce the chances of anyone contracting HIV.